Now turn to the urinary and male genital system. You need to know that there are two kidneys, and on each kidney is a renal pelvis that sends urine into the kidneys. Two ureters come off the kidneys and send the urine to the bladder. And there is one bladder for storage of the urine. And then there is one urethra that is used to exit the urine from the body. Let's look at this. As you can see, you have two kidneys. This is important because when you code procedures of the kidneys, you need to know that there's two. So you need to do a right and a left. There's two ureters. There's only one bladder and one urethra. And like I said, the urine comes into the renal pelvis, through the kidney, through the ureter, into the bladder, and out through the urethra. I'm sure you all have heard of stones or bladder stones or kidney stones. Stones are called calculi or nephrolithasis or kidney stones. Stones form in the urine and can lodge anywhere from the kidneys to the bladder. Common sites for stones in the ureters are at the junction of the ureters and renal pelvis, where the ureters cross the brim of the pelvic inlet and where ureters pass through the wall of the bladder. Stones cause significant pain and may damage kidneys. The sections of the urinary system are kidney, ureter, bladder, and urethra. The terms you should write in your book are nephro for kidney, cysto for bladder, and I remember that like a cyst is fluid filled, so fluid goes in your bladder. Urethro for urethra, and ureter for ureter, and those can get kind of look the same, so you want to really pay attention to the difference in those when they are in the code descriptions. Lith for stone, and philo for renal pelvis. General guidelines for this section. Each section has subsections for incision, excision, repair, and other procedures. Read the description of the codes carefully and watch for codes specifically stating when a procedure is unilateral or bilateral. When an operating microscope is used for a procedure, it should be reported separately. Remember that when a diagnostic endoscopy is performed with a surgical endoscopy, it is always considered inclusive to the surgical endoscopy. It is not reported separately. Let's talk about the kidney first. Turn to that section in your book. A nephrotomy is 50045, and it is incision into the kidney and may be used to explore the kidney. A nephrostomy is an opening into the renal pelvis, communicating with the exterior of the body. Most often, a tube is placed. Nephrostomy serves to drain urine out of the body. And remember, stomy means artificial opening. Nephro means kidney. Nephrolithotomy, we just learned that nephro is kidney and lith is a stone. So a nephrolithotomy is a removal of a stone. Remember, litho, calcus, and stone all describe the same thing. It just depends on how the doctor documents it in the medical record. Percutaneous is from the outside without an open incision. Percutaneous nephrolithotomy or phylolithotomy can involve use of endoscopy, lithotripsy, stenting, or basket extraction to remove a stone up to 2 centimeters or over 2 centimeters. Now, phylolithotomy, because you know the terminology, you know philo means renal pelvis and litho means stone. So that's where they are taking a stone out of the renal pelvis. So don't get that confused with a nephrolithotomy because that's where they're taking a stone out of the kidney. You should write this on that page. Phyllotomy 50120 through 50135 is the incision into the pelvis of the kidney. Now go to the kidney excision section. Excision codes report biopsy, nephrectomy, and removal of cysts. The codes are listed by approach, percutaneous or open. Nephrectomy is removal of all or portion of a kidney using an incision. Laparoscopic nephrectomy is reported with 50543 and 50545 through 50548. Whenever you see radical used with a surgical procedure, think cancer. In regular surgeries, only the organ to be removed is removed. Radical surgery indicates that other tissues are removed. For example, supporting or adjacent structures and areas of lymph nodes are taken to be examined by the pathologist looking for spread of cancer and to remove all malignant tissue. Operative reports will hopefully contain descriptions of extent of disease and tissues removed. Ablation is removal of a body part or destruction of its function via surgery or noxious substance. Related to kidney procedures, ablation of one or more renal masses is performed using cryosurgery, freezing temperature. If ultrasound is used intraoperatively, it is included in the code. Laparoscopic ablation of a renal mass is reported with 50542. This is the table of contents in the urinary system. You've got the kidney, ureter, bladder, and urethra. This is the excision section we just talked about. You have the renal biopsy, percutaneous, by needle or trocar. For fine needle aspiration, use 10022. For evaluation of fine needle aspirate, see 88172 and 88173 in the path and lab section. If the renal biopsy is done by exposure to the kidney and not percutaneously, use 50205. Nephrectomy procedures are coded with 50220 through 50240. 50220 through 50230 are nephrectomies including a partial excision of the ureter. 50225 is complicated because the previous surgery on the same kidney. And 50230 is radical, which we talked about. Radical, think cancer. They are taking out a lymph node, a lymphadenectomy, or vena caval thrombectomy. A nephrectomy with total ureterectomy and bladder cuff through the same incision is 50234. Through a separate incision is 50236. Nephrectomy partial, so that's a partial excision of the kidney, is 50240. An excision or unroofing of a cyst of the kidney is 50280. This is the renal transplantation section. You should read over the guidelines for the cadaver donor nephrectomy, unilateral or bilateral, backbench work, and recipient renal allotransplantation. Let's look at the codes. Although sloppy, I have it bracketed where I have backbench work in a bracket and the transplant work in a bracket. As you can see, the backbench work, there's two categories, one for preparation and one for reconstruction. They are either preparing the allograft or reconstructing the allograft. The preparation of allograft is 50323 and 50325. If it's coming from a donor, it's 50323. Coming from a living donor, it's 50325. 50327 is for reconstruction with venous anastomosis. 50328 is atrial anastomosis. And 50329 is ureteral anastomosis. 50360 and 50365 are for allotransplantation. So that is coming from a donor, allo. For autotransplantation, also called reimplantation of a kidney, is 50380. Now I turn to the kidney introduction section and follow along. Codes 50382 through 50384 are percutaneous procedures for removal or replacement of ureteral stents. Those are stents in your ureters. And remember, you have two of those. These codes include radiological supervision and interpretation and report. Reminders are given to use modifier 50 for bilateral procedures in parentheses under the codes. Listed in 50385 through 50386 are codes for transurethral through the urethra approach for removal or replacement of ureteral stents. Numerous parenthetical notes with information about modifier usage and reporting are in this section. Phylography is a radiological visualization of the kidney, ureters, and the bladder using the aid of contrast agent injected directly through a ureteral or nephrostomy catheter or percutaneously. The parenthetical notes include useful information regarding radiological supervision and interpretation of these procedures. Manometric studies measure the pressure and flow of urine. Phyloplasty is a plastic repair. A phyloplasty is a procedure for an obstruction of the uretero-pelvic junction, UPJ. That would be a good thing to write in your book. UPJ stands for uretero-pelvic junction. This can be congenital or acquired condition. Report 50400 for a simple repair and 50405 for a complicated repair. Nephraphy is, remember, raphe is the suffix for sewing or suturing and closure of a fistula, and nephro means kidney. So nephraphy is a suture of a kidney wound or injury, usually from trauma. Fistula's abnormal connection between two body parts are reported with 505.20 through 505.26. Also in the kidney repair section is laparoscopy codes, and they are often abbreviated with the word scope. As in many, if not all areas of the CPC, diagnostic laparoscopy is included in the surgical laparoscopy. They are not reported separately. Diagnostic laparoscopy only in this area is reported with 49320. Endoscopy codes report less invasive kidney procedures. Nephrostomies and phylostomies report procedures where the endoscope is going through an established opening between the skin and kidney. Remember, a stomy is an artificial opening. Codes 50570 through 50580 report nephrostomies and phylostomies in which the endoscope is placed through a small incision in the kidney or renal pelvis. Now let's look at the ureter section. A lithotripsy is a non-invasive procedure for treating kidney stones using shock waves to break them up. They are then passed. Ablation of renal tumors is listed with radiofrequency and cryotherapy. And remember, cryo is freezing. Incision codes report open procedures for the purpose of exploring and inserting an indwelling stent. Indwelling indicates left in place, not temporary. That would be a good note to write on that page. In many instances, it will remain there for 3 months or more. If the stent is placed for a couple of weeks, it's considered temporary and not coded using 50605. Codes 50610 through 50630 are used to report the removal of stones from the ureter and are selected based on the location in the ureter. Now turn to the bladder section. The bladder section is a large section. And again, just as with other sections, there's incision, removal, and excision listed. The incision category contains codes for insertion of radioactive material or destruction of intravesical lesions, as well as removal of stones. A lithotomy is the surgical removal of calca, which is stones. Cysto means bladder. Code 51050 is a cystolithotomy, the removal of a stone or calculus without vessel neck resection. These three removal category codes, 51100 through 51102, represent the aspiration of the bladder and are selected based on the method. Excision codes report excision of urachal cysts or sinus. This category contains a range of cystotomy and cystectomy codes. These codes are divided based on the extent of the procedure and whether they are partial or complete. Code 51596 contains the word neobladder. Neo means new, so this means a new bladder. Pelvic excineration is the radical removal of pelvic organs and adjacent structures due to malignancy. This is only used for cancer. The parenthetical instruction beneath 51597 tells the coder to use 58240 if pelvic excineration is for gynecologic malignancy. The introduction category lists codes for injection, insertion, and installation procedures. Injection codes are the urocystography, radiological supervision, and interpretation is reported in addition to the injection procedures. That would be a good note to put in that section. Insertion of bladder catheters is reported based on whether the catheter is non-dwelling, temporary, or indwelling, complicated. Code 51720 is for the installation and retention time. Installation is performed for bladder cancer, and anticarcinogenic agent is instilled into a bladder using a catheter and is retained in the bladder for a period of time. There are a series of installations in a course of treatment. Now turn to the repair section. Repair codes for bladder repair are bladder and urethra repair, urethropexy for SUI, and closure of fistulas. Colposuspension is a repair procedure for SUI. Sling procedures also can be used to support and elevate the ureteroviscal junction, where the urethra joins the bladder. Other procedures include Marshall-Marquette Krantz, MMK, Birch and perivaginal repair. These procedures are reported with 51840 for a simple repair and 51841 for a complicated repair, which would include a secondary repair of the bladder. I would write that next to the code. The urethral sling and suspension may also be performed laparoscopically and reported with 51990 or 51992. 51990 is used when they suture it up, and 51992 is used when the sling is used. Cystourethropy codes are bundled endoscopic procedures. Be sure to read the details of each description in this category before assigning the code. The endoscopy codes are coded by location. Now turn to the transurethral section. A transurethral surgery category contains procedures for the urethra and bladder and the ureter and pelvis. Report 52204 when a cystourethropy and a biopsy are performed. Cystourethropy means cysto for bladder, urethro for urethra. Transurethral resection of a bladder tumor is called TURBT, T-U-R-B-T, and it is a procedure to remove a bladder tumor with fulgration and or resection. The code is reported based on the size of the tumor and only billed once. Because multiple tumors are included, if you have a 1 centimeter tumor and a 3 centimeter tumor, you would select the code based on the largest tumor, which is 3 centimeters. Ureter and pelvis subsection has important notes preceding the code range that should be reviewed by you, the coder. As an example, you would not code 52000 in addition to 52320 through 52343, since the therapeutic cystourethropy always includes the diagnostic cystourethropy. Now let's turn to the urethra section. Urethra category codes include the now familiar incision, excision, and repair categories. Endoscopic procedures of the urethra are found in codes 52000 through 52700 and have already been considered. Urethrotomy 53000 is the incision of the urethra for relief of a urethral stricture caused by injury, inflammation, or infection. Meadotomy is an incision made to enlarge the meatus. For an infant, 53025 is reported. If the meadotomy is the only procedure performed, it may stand alone. You wouldn't append modifier 63 to code 53025 since the code is specifically for infants with a body weight less than 4 kilograms. Skene's glands are located on the wall of the vagina and drain into the urethra. When infected, the gland becomes enlarged and very tender. Report 53060 for drainage of an abscess or cyst of Skene's gland. Excision of Skene's gland is reported with 53270. Now let's look at my book so you can see some of my notes. Back in the introduction section of the renal pelvis catheter, I like to put notes like remove and replace so I can easily find what I'm looking for when I know that I'm coding a catheter procedure. I also on the other side put percutaneous or transurethral. In the endoscopy section, starting with 50551, notice how I bracketed the stomies versus the otomies because those can easily be misunderstood during trying to find the answer during the test so quickly. Because they look so much alike. So the 50551 through 50562 are nephrostomies or phyllostomies, and remember a stomie is an artificial opening. And 50570 through 50580 is for a phyllotomy or a nephrotomy, where they are just cutting into the structures. Code 50590 is for a lithotripsy, which is breaking up these stones with a shock wave. This is commonly called ESWL, and it could be called that in a question or in a scenario, so you might want to write ESWL next to that code. If these tumors are ablated with radiofrequency, then you would want to code 50592. If tumors were ablated with cryotherapy, percutaneously, you would want to code 50593. Remember that an indwelling stent is a permanent stent, so don't get that confused with a non-indwelling stent. The bladder tumor codes are 52224, cystourethral with fulgration or treatment of a minor lesion with or without biopsy. They call it a lesion because it's less than 0.5 centimeters. If it is 0.5 centimeters to 2.0 centimeters, then you will code 52234, and that is considered a small bladder tumor. 52235 is for a 2.0 to 5.0 centimeter tumor, and that is considered medium. 52240 is over 5 centimeters, and that is considered large. Notice how I put the sizes next to the code to easily identify them. Notice how I bracketed 52341 through 52343 for cystourethral, and I bracketed 52344 through 52355 because it is a cystourethral with ureteroscopy, so they are going into the ureters. Next is the male genital system, and this is grouped with the urinary system because it is a relatively short system. You need to study the anatomy of the male genital system. You have the penis, testes, epididymis, tunica vaginalis, scrotum, vas deferens, spermatic cord, seminal vessels, and the prostate. The terms you need to write down is orchid and testo for testes, balano for head of penis, andro for male, prostate for prostate, and vaso for vessel. Raphy is to suture, like we've learned. The penis subsection is covered in codes 54000 through 54450. The incision category, there are significant parenthetical instructions. Code 54015 is incision and drainage of the penis deep. Remember, there are also incision and drainage codes in the integumentary system, so it must be deep. The destruction category is for the destruction of lesions of the penis. To select the appropriate code, you must select whether it is simple or extensive, then select the method of destruction. The excision category contains codes for biopsy, removal of foreign body, amputation, and circumcision. Code 54100, biopsy of penis, separate procedure, has a parenthetical designation as a separate procedure. There are 4 amputation codes. The code selection is based on whether amputation is partial, complete, or radical. Circumcision codes are selected based on the method and age of the patient. Make sure you pay attention to the parenthetical notes here. It's very important. Now turn to the testes section. For the testes subsection, remember that orchi means testes. The excision category includes biopsy, excision, and orchiectomy, so excision of the testes. There are 2 biopsy codes, needle and incisional. Both of these procedures are designated as separate procedures. Orchiectomy codes are selected by whether the procedure is simple, partial, or radical. Repair codes include codes for orchiopexy. Orchiopexy is a surgical procedure to move an undescended testicle into the scrotum and fix it there. The epididymis and tunica vaginalis section, there is 1 incision code, 54700, which is for an IND, incision and drainage. The excision category range is used to report biopsy of the epididymis as well as an excision of a lesion of the epididymis. A spermatocele is a retention cyst of a tubule of the epididymis that, when removed, may or may not include the removal of the epididymis. The tunica vaginalis is a serous sheath of the testes. It is here that the hydrocele might form. Code 55000 is used to report the puncture aspiration of a hydrocele of the tunica vaginalis. The vas deferens category is next, and the vas deferens is the tube that conducts sperm from the testes to the urethra. Code 55200 is an incisional cutting into the vas deferens, also known as vastotomy. Introduction 55300 category is for a vastotomy for vastograms, seminal vesicograms, or epididymograms. The spermatic cord is a cord-like structure that suspends the testes in the scrotum. It can be the site of the formation of a hydrocele, lesion, or varicocele. Excision of a hydrocele of the spermatic cord is a unilateral procedure. The excision of a spermatic cord lesion is reported with 55520. A vesiculectomy is a surgical cutting into the seminal vessels, either through an incision into the lower abdomen or between the anus and the scrotum, perineum. There are 2 codes to report a vasculotomy, depending on the extent and dissection. Report 55600 for simple dissection. A complicated dissection is reported with 55605. And finally, the prostate. This section is grouped by incision, excision, laparoscopy, and other procedures, just like pretty much all sections in the CPT book. Code 55700 is biopsy of prostate, needle or punch, single or multiple, any approach. It is commonly performed. This is because it is common for the prostate to be enlarged. There are parenthetical instructions at the beginning of the excision section. All of the codes listed are open procedures, not transurethral. Cryosurgical ablation of the prostate is ablating, which means destroying the prostate tissue using extreme cold. Now let's look at my book. A very common procedure performed in the excision section of the penis is a circumcision. 54150 is a circumcision using a clamp or other device with regional or ring block. So the key terms here are clamp and ring block. 54160 is circumcision, surgical excision other than clamp device or dorsal slit for a neonate, 28 days of age or less. 54161 is older than 28 days. 54405 through 54417 are penile prosthesis procedures. They are coded based on inflatable or non-inflatable. I have these bracketed in those sections. Just like any other prosthesis, there is an insertion code, a removal code, a repair code, and a removal and replacement code. That's the end to the urinary and male genital system lecture. Make sure to study and take your exam.